Good morning and welcome to our annual conference presentation, The Journey to a New Mark of Quality in Home Health and Independent Living. We are going to be discussing Engage BC's new program, Assurity, today. And in doing so, we're going to be discussing what today's home health and independent living consumers need, and perhaps more importantly, what they want. We'll also be talking about the journey that we have taken to develop the new quality assurance certification and talking about the unique components which make this model truly consumer driven. I'm here today with Melanie Reinhart and Stasia Hartley, who will be introducing themselves.
Melanie, you go first.
Okay, I was going to say, I'm not sure if we're going to handle it. Anyhow, so good morning, everybody, and thank you for joining us again at the journey to the new mark of quality. My name is Melanie Reinhart. I am the chair of the Engage BC Council. I also have the opportunity to sit as a BC Care Board member. I am the president of a company called Vantage Living, and Vantage operates long-term care, assisted living, and independent living in BC. And I've been really pleased to work with Rebecca and the team on the Assurity process since we began in 2019. I see the home health and independent living sectors are both developing and maturing, and now is the right time to bring in the quality framework. Excited to talk about the program we have to offer you today, and also introduce Stasia Hartley, our other panelist.
Thanks, Melanie. Rebecca. I am on the Engage BC Member Council and also chair of the Home Health Committee. I'm the area director for Bayshore Home Health on Vancouver Island. I've been in that role for 10 years, and recently I took on the interim regional director for BC. And of course, I first got involved in Assurity way back in 2018 when we started looking at developing standards for home healthcare companies. So I'm really excited to see that we've come this far and that we're about to engage and discuss it, and hopefully engage more of you to join us in this seeking of quality standards.
And finally, I'm Rebecca Frederick. I am the director of Engage BC, and I've been the staff lead for the development process as it relates to Assurity. Assurity was truly developed in response from our membership. I think one of the most meaningful moments for me in this project is when a home health operator, looked at me and said, Rebecca, we don't want to be known by the lowest common denominator out there in the sector. We want something that really indicates that we're a cut above the rest. And so that was what we have been doing over the last number of years. We've developed something which we truly feel is consumer driven, and we're looking forward to talking to you a little bit about that today. Through today's session, we'll be doing a short Q&A here with Melanie and Stasia, and then I'll be delivering a short presentation on the Assurity program. We'll then be taking a live Q&A from conference participants, and of course, are very happy to answer any of your questions if you would like to reach out to us following the conference. So with that, I would like to ask you both, Melanie and Stasia, what is the average home health or independent living client looking for when they're seeking your services?
Rebecca, I'll take a run at the response on behalf of the independent living sector. And it's important to always, for my team, to remember that when folks approach us for independent living, this is marking a major milestone in their life. They're contemplating the transition from life at home or on their own to an independent living or retirement community setting. These consumers are looking for safety and security. They want a good meal, some strong Wi-Fi, and a location that they are comfortable with, something close to what they're used to having. And the post-COVID or pre-COVID days as we're in, we're seeing a younger population making those inquiries about what is independent living. So we're not only educating our new consumers, our prospective clients, on what it is that we can offer at a particular location, but also understanding that they're learning about the industry and its opportunities. They're also looking for a chance to verify whether this is the right time in their life to make this transition.
No, it's not something that many of us do twice, is it?
True.
Yes, and with regard to home health care, I always say to people come to us for a service, but they stay because of a relationship. And so the average home care client may only be looking for a couple of hours a week of basic home support, or they might need 24 hours care, full-time care over a 24-hour period. But the key is that they're looking for continuity of care. They're wanting to know who the care provider is, and they're wanting to know that the quality of care that they're receiving, or more likely their loved one is receiving, is a high quality and is accountable for the type of care that we might be providing. So I think overall people are looking for continuity and looking for a relationship in that care.
Melanie, perhaps you can speak a little bit to how today's independent living consumer is different from what they might have looked like perhaps 10 years ago.
Good question, Rebecca, because that consumer market has changed. We are seeing our new prospective clients are key advocates for themselves. And I would underscore that generation with the advocacy moniker. These clients are willing to ask questions. They are aware of elements of quality like the Assurity model can provide. They are looking for a choice. They know that they have options. These folks generally have a couple extra dollars that they are able to spend and willing to spend. So their disposable income is a bit higher than the generation that we saw 10 years ago. But we're also seeing more willing to ask for services, folks who more want to be involved in the operations actually of their independent living site. So they are fully advocating for themselves. They are ready to ask the questions and they want to know that they're getting the quality for the services they're paying for.
And what about you, Stasia? How have you seen your clients change over the last number of years?
Yeah, what we're really noticing is that individuals are becoming more medically complex in their desire to stay at home. They will live longer and at home with assistance, whether it's equipment, or in many cases, what we're seeing is increasing numbers of dementia. And, you know, with over 500,000 people in Canada suffering from dementia, and that growing to probably close to 1 million in the next 10 years, this is really putting a demand on care and care at home. So what we're seeing is that they may only need, they may need only supervision in the sense of what they need at home, or they may need some very high level care. But overall, we are seeing the demand for more care in terms of time in the home is definitely increasing.
Okay, so we're seeing a greater acuity in your case, Stasia, and seeing a consumer that seems to know a lot more, ask for a lot more, and want to be more directly involved in your case, Melanie.
Yeah.
Tell me how somebody makes the decision about where they want to live, or Stasia, in your case, what kinds of supports they need. How do they make that decision that yes, it's time for a little bit more support, or yes, it's time for a different living scenario?
So in independent living, sometimes we see a sentinel event. Sometimes we see an event in life change that makes folks want to inquire about living a little bit differently than they do right now, perhaps a little bit additional safety and security. But I agree with the findings of the Howe Group survey when they said that folks choose their independent living site based on what's nearby. They want something in their home community, something near their family. Very often there's not a whole lot of shopping around. Sometimes the question is greater about, should I choose site A versus site B? It's a greater question of, is this now my time to move into independent living? I know that people are in a life transition timeline when they're coming to us, and there's a lot of variables going on for most of our clients.
We're in a similar situation, I think, in home care in that transitions happen. And sometimes it's a crisis that has the family calling us. Either someone has had a fall or they're being discharged from the hospital and the family's not ready and perhaps government care isn't set up. So we're getting those types of phone calls, which are not planned. They're calling, and the reason they call might be recognition of the company. It might be often some referrals, but often they're in desperation calling around to find out who can provide and help support. I think the other thing we see too is that there is some planned level of home care in that as families realize a loved one wants to stay home, they will start calling around to start those first levels of support. And it might only be a couple of hours a week, but starting to introduce the concept of companionship and care and home support to ensure that aging in place is safe.
Thank you. I think that what you have to say probably resonates with many people on the session today. A recent report from the Office of the Seniors Advocate noted a number of gaps, Stasia, when it came to the publicly subsidized home health care system and what currently exists. Those gaps included high costs for folks with moderate to low incomes and issues with continuity and scope of service. How does the private home health sector endeavor to attend to some of these issues and help fill the gap in our existing system?
Yeah, it's a really good question, and one we get a lot when people call in for care and when they're trying to figure out their options for care. And what I tell people is that the government is there for what you need. We've got a wonderful system that if you need care, the government will set up that for you. But often what people want is more than the need. They want more than just basic care tasks looked after. And so the private world has risen to that demand, because it is a significant demand, to be able to provide more holistic care, meal prep, housekeeping, companionship, those types of things, along with, of course, the important personal care that's involved in caring for individuals. So we're trying to fill that gap, and yet at the same time, the demand for care grows, and the ability for the government to care for everyone is limited by the number of care aides that are even out there. So that all is a converging situation, which is increasingly leaving some of our seniors and our families a little bit vulnerable for what they can afford, what they need, and then of course the important part is what they want to be able to stay safe at home.
Yes, lack of staff is definitely something that is so pervasive across our whole continuing care sector, and obviously somewhere where we've been putting a lot of attention to as an association. Melanie and Stasia, I'm interested to know a little bit about how you monitor your business to see if you're keeping up with industry standards.
Good question, Rebecca. I mean, I think in the independent living industry, there's not a whole robust basket of things we can look to yet to monitor that business. But just like I would reach out to a CEO group or a CEO forum or an industry association to see how I'm doing in my business, I would reach out with the support of an industry standard, something like the Assurity, or very much the Assurity model, to evaluate my progress and my team's progress as a business. I think we'll see the good questions come up that identify the gaps and provide the resources that we need in order to evaluate how we're doing as a business.
Stasia,
Yeah.
what about you?
I think in home health, because there's so many home health care providers and so many people who operate in a home health type of environment, maybe not as a full-on operator, but they're providing services. We, as an agency, we can seek accreditation, and some of us do. But the reality is most people don't. So where Assurity comes in is it's that opportunity for us to be able to network together and help each other ensure that we are monitoring the types of policies and procedures that a good home care company should be following in order to provide that safe care.
Yes, I know that so much of the work that I've been involved in with both of you as we've looked to sort of set up Assurity has been trying to determine, well, what the heck actually is industry standard and what does that look like? There's just such a variety out there. And so drilling down on, well, what exactly should be happening has been, a couple of years worth of work. And we think that we've hit the mark, and we're looking forward to the feedback of everybody who's attending today's session once you go through becoming Assurity certified, which we hope that you will. So I'm interested to talk to you a little bit about staff. Of course, we have a pervasive staffing shortage right across the sector, which is something that we've been really focusing on as an association, as I've mentioned before. But I'm curious to hear from you about what is different from your staff today than the situation perhaps 5 or 10 years ago.
And in order to provide the good service we want, we need to make sure we've got the great staff who can provide that service. And in order to have great staff who provide great service, we need to treat them right. But in a COVID world, it makes it even a little bit more complicated because our staff are coming to work and they want to know they're being safe. Their family members, I've had parents call me and ask me if their son or daughter was safe working in our environment. And because we're part of a healthcare industry, our staff are, I believe, safer in the workplace than they are almost anywhere else, because we have taken the precautions, we've tuned our ears and our eyes to the rules and regulations, and we are vigilant about maintaining that COVID safety. But there's another change that's taking place in our work environment, and that is how people come with their attitudes and their hopes and their desires from what they want from their job. I'm sure we've all seen the Simon Sinek interview where he talks about the fact that most younger employees, those entering the workforce, want impact. And so how do we provide that need for impact in a seniors care environment? Well, there's the obvious way of saying you are impacting the lives of individuals who require and rely on you for your support. And that is a very meaningful impact for some folks. But for others, it's important for us to highlight to them that this might be your job that gives you the skills and tools to move on to yet another job. And in our world, I see that in our company as our transitional workforce, where we're saying, come to us, we'll train you in certain areas. I'll train you how to serve fine dining, and then you can move to that job on the cruise ship that you want to. And we want to celebrate our alumni. We want to face the new world with optimism and meet their needs instead of trying to have their needs conform to ours.
Yeah, Melanie, I think you hit on a really important point right now, that with the demand for care, we're seeing new people coming into the industry. 10 years ago, most of the applicants would be registered care aides. Now, many of the applicants are not registered, but they have had a lifetime of experience in caring for people, or they have a genuine interest in caring for people. And so with this demand for care, the need to be able to train and set them up to care in a safe manner is so important. I'm really excited that the BC Care is offering the Seniors Health and Hospitality Training Program as one of the examples of bringing new people into the industry to set them onto a career path. But the other piece is, and this is what I really have been finding in the last couple of years, people who have been providing care privately for years, because they're seeing how much more complicated care is becoming with their clients that they've had, or with the pandemic, the need to feel safe as an employee, we're seeing them seek out employment with us to say, now's time for me to actually work under an agency and not be out on my own and all by myself. So I think that's been a real transition of people with long-term care experience in the sense of their time in the field, I'm talking about home care, who are now looking to work under an agency to have those, to be able to have that protection and feel confident about the care that they're delivering.
And what kind of role do you think Assurity can play in helping you support those staff, whether it's helping spread the message that, yes, this is a good place to work, it's a safe place to work, or whether it comes to making them feel good once they're already employees with you?
So I think one of the things that Assurity can do is help standardize our language. So if we are an agency and we're Assurity vetted and another agency has followed the same process, we're going to use the same lexicon, the same dictionary for how we describe our services. We may have similar processes and policies and expectations of our staff. So that creates some stability within the industry. So there's some sameness between home number one and site number two, so that it's easier for staff to learn and grow throughout the industry. I think we can attract people to our sector. We can help grow it up a little bit in order to have that common language and that common framework that will enhance both our resident experience and our staff experience.
Yeah, I would agree that I really see the Assurity seal as a opportunity for employees and future employees to really look at who they're going to apply to, who are they going to join. That's a commitment of time. They want to know that they are with an agency that is following standards of care, not just for the client, but for the employee, and recognizing that it's an employee's world out there right now. There's lots of opportunities for them to go work. So I think the Assurity seal will give them some terms of reference and an ability to ask the right questions when they sit down with a future employer to ensure that the time that they take to join that team is worth it.
Is there anything else you think that our audience should know today about either the Assurity program or the changing landscape in terms of what clients are coming through the door asking for, what staff are asking for?
I think that now more than ever is our time to show our strength and our quality. We are going to see more focus on seniors housing and seniors support from all levels of government and all levels of our community. So now is our time to stand up tall and stand up proud and be the people we've always been, but put a framework around it so that the good quality services we're providing now can be acknowledged and can be managed and reflected through a program like Assurity.
Yeah, I really see the home care industry as a community of care. One agency alone cannot do this. And so we need to join together in order to care for our seniors and those with complex health issues. And by working together and helping each other raise our standards of care, we better the community, we better the industry. And the ability or the opportunity to be part of Assurity also just helps raise awareness so that, again, future clients, future employees have a place to go to find information and to find operators that are speaking, like we keep saying it, the same language, but helping people even understand that language, I think, is a really important part. So BC Cares program, I think, gives a landing place for people to work together and to bring together the community.
Thank you, Melanie, Stasia. I'm just going to go into our PowerPoint presentation and just provide a little bit of an overview of the Assurity program. Once we've done that, we'll come back for a few final questions, and then we will transition toward live Q&A. Just bear with me for one moment here. Okay, so thank you again for making this a part of your conference schedule at this year's BC Cares virtual conference. Looking forward to doing a little bit more of a deep dive into the Assurity program and how we got to where we are. Obviously, you've had an opportunity to hear from our fabulous panelists already this morning. So why Assurity? We know, and this has really been communicated very clearly by Melanie and Stasia already this morning, that today's seniors are savvy consumers. They understand that they have many choices when it comes to independent living or home health services in their community. We know that these are also both unregulated components of our sector, and that there can really be a lack of clear indicators that are consumer friendly as it relates to quality in home health and independent living. As such, we heard really strongly from our members, from industry experts, that a tool was needed to help seniors navigate the existing marketplace and to help us further define industry best practice. Again, as Stasia and Melanie spoke about, really defining that lexicon and ensuring that we're speaking a common language across our sector. So we've gone ahead and we've developed Assurity. It is BC's new quality certification tool for independent living and home health. And we really feel that it offers consumers a practical approach to meeting industry standards. We're confident that it will help seniors find the best services the sector has to offer, and that people will be asking for it by name in the months and years to follow. The program was developed by Engage BC in extensive, as both panelists will tell you today, collaboration with industry experts, along with consultations with seniors and families who use and depend on these services. And I'll be speaking to the findings of those consultations a little bit more in a few moments here, but we really felt that it was critically important that if we were going to say that this is a program that's consumer driven, that we actually spoke to the end user about what they would want to see in a program and the kinds of things that they look for when they're searching for care or an independent living home. I do just want to take a quick moment here to acknowledge the efforts of the many contributors to this program: the Engage BC Member Council, the Engage BC Home Health Committee, the Assurity Independent Living Advisory Group, the Assurity Pilot Group, and the Assurity Pilot Group for Home Health. We'd also like to thank the members of the public who participated in focus groups and surveys, and the operators who participated in one-on-one consultations. So in other words, letting me talk their ear off about what kinds of things they'd like to see. So thank you to everybody who has participated in helping us develop the Assurity program. I wanted to also overview the foundations of this program. It is a self-attestation model, which is supported by evidence of policies, procedures, and practices. It is largely a virtual program because we heard from you that that is the approach you'd like to see us take. It is a 2-year certification process, so your Assurity certification will be good for a 2-year period, at which point an operator will need to reapply. And it's not intended to be a substitute for accreditation. And I think that's something that we really want to be clear about. There are organizations who will decide to accredit, but this is not intended to be a substitute for that process. We know that accreditation in some cases is also out of reach for some of the operators that we work with. It can either be too time consuming or too expensive, particularly for smaller operators. Independent living operators that participate in the Assurity program will be required to circulate a resident survey halfway through the certification cycle. That's a standardized set of questions that we will be using to help us get a sense of how residents think things are going. And in time, that information will be available so that an organization can compare themselves to other independent living operators out there in the sector. This information will be anonymized, so no need to worry about that, but it'll give you some ability to get a sense of where you stand in relation to other operators. We've really focused a lot of time and effort on ensuring the application process is easy to navigate. My colleague Marjan O'Connor has done an excellent job at making sure that everything looks beautiful and feels easy, even when we're asking for a fair bit of information to support your certification. It's also supported by an audit process and member council oversight. So those are added measures of accountability that help us know that this program is robust and is supported by strong foundations. We're also focused on iterative improvement. We don't want this to be a program that isn't updated over 5-10 years. We constantly want to be adapting this program to ensure that it's keeping pace with industry standards and giving the public a clear sense that this is truly a program that can give them confidence when they're looking for home health or independent living services. I won't read these out word for word. If you are a member of ours, you can access the Assurity application manual on the Assurity portal. But this just gives you an idea of the kinds of things we'll be looking for through an Assurity certification process. We've broken this down, and this is for independent living, we've broken this down into 2 sections: regulatory and legislative requirements, and operational excellence and hospitality. I will note that our program truly is focused on independent living. We have not included assisted living in our independent living model. And the reason behind that was that with the implementation of the new assisted living regulation, it would really be a lot of duplication for something that is already quite heavily regulated. So we made a decision to truly focus this on independent living. There are quite a number of substandards under each of these areas, so I do invite you to take a look at the manual should you have further questions. This is a little bit of a preview of what we look for when we're doing the home health application reviews. Again, we've broken this down into regulatory and legislative requirements and operational excellence and hospitality requirements. So just a little sneak preview of what the Assurity application portal looks like. It includes that downloadable application manual to help you prepare and apply for certification. There's a copy for independent living operators and a copy for home health operators. It also includes a resource center, which includes links to relevant regulations and legislations and other resources that we feel may be helpful for you to work through the Assurity process, and perhaps put things in place if you're finding that you are missing something that you should have in place for the certification. We are really intending to continue to grow out that resource center as the program develops. So if there's something that you don't see on there, which you really feel would be helpful to you as an Assurity participant, please let us know. We do, again, just intend to continually be improving on this program and making changes as we go. You'll also find a frequently asked section component on the website, and that's where you will actually be able to access the online application system. I do also encourage operators to, once they've had a chance to review the application manual, spend some time with Marjan. She's always more than willing to set up an appointment with you to answer any questions that you might have before you go through the actual application process itself. So again, I do recommend that you take a look at this. And so this is an example of what you will see when you actually go through the process of providing your attestation and uploading your documents. We've tried to make this user-friendly. If you do have any questions about it, please do reach out, and we're more than happy to answer them as best we can. We do have an audit process or a verification process, and we are planning to audit 10% of all applicants in both home health and independent living. These audits will be conducted by Engage BC staff, and it really just is an opportunity for us to review any policies or procedures that we may not have asked for during the actual certification process itself. We have a tiered non-compliance policy in place, which, hopefully we don't have to use too frequently, but it ranges from requiring operators to amend their practices within a certain time frame. So that would be the approach we would take with, a minor non-compliance issue, to revoking the Assurity certification in full. So we have some ability to really adapt our process as the severity requires. The Engage BC Member Council, along with the support of the Home Health Committee, will act as an oversight body should any discrepancies take place between operators and Engage BC staff through the audit process or through the certification process. So I want to just spend a little bit of time talking about what the public told us and how we use that insight to inform our program. You'll see this lovely group of independent living residents here that took place at, I believe it was Greystone Manor in Maple Ridge, which is a Park Place site. We did 6 focus groups in total. We did 3 with seniors living in independent living homes and 3 with family members. And so seniors told us that location was really important to them when they were picking an independent living home. So they looked at things like neighborhood, proximity to family and friends, services and amenities as being the most important elements that they'd look for. Following closely were things like building amenities, such as the size of the suite. Food came up. I know that food comes up with all of you on a daily basis if you're offering independent living. Air conditioning and having laundry en suite. Families shared similar perspectives with really looking for what the best fit, the best feel was. They likened this to it being a similar process as shopping for just a regular home. You want to see if it feels like it's a good fit to you as an individual. Again, food came up, and really seniors heavily weighed their choice based on word of mouth from friends and family and community connections. Seniors tended to look at 1 to 3 places. So in some cases they were shopping around more, in some cases they were shopping around less. What the public told us in terms of home health clients, they reported that it really was challenging to find and comprehend publicly funded. They told us that they find it very difficult to find and comprehend publicly available information. I will note that this was a survey that we did in advance of developing the Route 65 tool. So I think we've really had the added benefit of being able to integrate Assurity into a service, which really makes it easy for people to navigate the continuing care sector and learn some of the tools and some of the vernacular that we use across the sector. They also told us that it was very difficult to accurately compare one organization against another, given that there were a few standard metrics, guidelines, or policies available to the public. So there really did seem to be a need for something like the Assurity program. The majority of our respondents agreed that having some kind of logo or symbol, similar to what we've done with Assurity, would be helpful in guiding them to choose a provider when we're speaking specifically about private pay or family retained home health services. So how have we taken all that? How have we taken what we heard from our operators, what we've heard from the public, what we've identified as being a need in terms of an industry tool, and wrapped that into something that really felt that it kept the consumer at the center? And this image is of Elam Village here, a lovely large turnout. So we have integrated this into Route 65, as I've mentioned. We'll be making those updates to the Route 65 website available early in June. And we have really developed what we feel are clear and transparent tools for families and their supporters. So we've gone ahead and we've developed checklists, both for home health operators and for independent living providers, so that they're asking you similar questions when they walk through your front door as we're asking you when we are providing your Assurity certification. We've also integrated that survey at the 1-year mark so that there is a bit of a checkpoint. I know that the vast majority of you already have tools that are used at your site, but we felt that integrating something at the 1-year mark was another way that we could build accountability into our program. We also have ensured that there are many opportunities for clients to share their feedback with you as part of the certification standard. So we wanted to know that you were regularly checking in with your residents and providing both formal and informal opportunity for their thoughts about things like food and the menu. Again, food really came up a lot. So what will we be doing? Because we know that this can be a very valuable program in terms of quality assurance, but if your consumer doesn't know to ask for it, it's not going to be a meaningful program. We are working on securing earned media, particularly as we come into the early summer here. We are utilizing all of our existing communication channels, which I know you know are quite broad. We will be engaging in paid marketing, particularly through Facebook. We found that to be a pretty successful tool, engaging primarily with the adult children who are looking to support a older adult in making a transition to independent living or seeking home health services. And we have provided a great set of tools to help you indicate to your consumer that you are Assurity certified. We've also been doing a lot of stakeholder engagement, talking to our many wonderful partners across the sector about this program so that they know that it's a tool that's available for the seniors that they support as well. We'll be cross-promoting the program through Route 65. I know that many of you are familiar with Route 65 already. If you aren't, check it out. Make sure your organization has a listing up there. And this will be an integral component of Route 65 going forward. We'll also be driving all of our public marketing to our Route 65 website that includes tools like those checklists. It'll be easy for operators to know if an organization is Assurity certified just by visiting the website. So it is important that you have your listing up before you go about your certification process. I will finally mention that we are running a limited time Founders Club rate, which are in place for sites and organizations which are looking to apply and become certified before September 1st. I really recommend that you become certified before that, because we will be doing quite a concerted marketing push over the next number of months. We have set a price for that Founder Club period of $575 for independent living, and that's billed into annual increments. And for home health, we are charging $345, again billed at two yearly increments of $172.50. So for the time being, these are quite modest costs, and I do encourage you to take advantage of them. So how do you get started? Please reach out to Marjan O'Connor, our fabulous program supervisor at marjan@engageseniors.ca, or reach out to myself, and we'll make sure that you're well on your way to becoming Assurity certified. So with that, I would like to bring it back to our fabulous panelists for a few final questions.
So I guess really what we're looking at is the ability to raise the standards of care as a community. At least I'm, again, speaking from the perspective of home health. And so when we look at the types of policies and procedures that we're looking to see have in place with an organization, what we want to let organizations know is that if you don't have it, that's okay. We'll help you build it. So it's really about raising everybody up into a standards of care. The other piece that I like about Assurity is just what you finished on, the marketing piece. You know, making the public aware, making the operators aware that this is available to them, and that they can go to that to grow their understanding and learning. And so from whether it's a future client or an operator that wants to do better, this is what Assurity can offer.
Thank you, Stasia. Any comments from you, Melanie?
Yeah, just one. My video might be on your side. And just wanted to say that as a BC Care board member, I've always been proud of the work that we've done to bring in standards and fill in the gaps where necessary in our sector.
Melanie, you know what it was? I think because you left and then you came back,
yeah.
You weren't a host. So should I just start again, and we can just?
Sure.
Does that sound good?
Do you want to start like right from the beginning, or do you want to start from after me and to say?
Maybe I'll start right from the beginning, and then it'll.
Okay.
Yeah. So with all of that, I'd like to wrap up with a few final questions from our panelists. Stasia, Melanie, perhaps you can speak to what you feel the biggest strengths are in the Assurity program as two people who have been really involved in this process right from the beginning.
Sure. I think there's a couple of things, but I think one of the things is standardizing the language and helping everybody in the sector understand what good quality care looks like. And I think what's really important is the policies and procedures that we are asking for. If an organization doesn't have them, that's okay. We want them to be able to come to that site and find those policies and procedures, or how to build them, and help them develop their own, so that we're raising the standard of care for everybody in the community. We can't do it alone. We really need to work together. And I see that Assurity offers that opportunity for the operators to grow our reputation as caregiving agencies.
Mm-hmm. I agree, Stasia. And I just want to say that as a BC Care board member, I've always been really proud of the work that group has done to bring in standards where there were any gaps. And this is what we're doing again with Assurity, is we're bringing in standards in order so that the community that's already providing great care can evidence that in a coherent fashion. We're not looking to recreate accreditation. Accreditation is a much larger process and much larger bill than the $575 or $375 that we will pay for an Assurity certification. This is our opportunity to show that we've got standards and build any standards we might be lacking and unaware that we're lacking. It's going to be our opportunity to showcase the good work we're doing now and improve it for the future. I think we're creating a path where no path currently is, and I think that's a pretty good standard for BC Care.
Thank you, Melanie. Thank you, Stasia. And thank you so much for joining me today on this panel. I know that our participants have probably enjoyed hearing from you today, and we look forward to taking any of the participants' questions in our live Q&A. Also, would just like to remind you that we would be more than happy to answer any questions if you do have them and aren't able to attend our live Q&A. So we will transition to that now. Thank you again, and please enjoy the rest of the conference.